Yes, good day to everybody. Barkanmu da warhaka.
Next lecture
wannan episode video shine za mu yi magana akan dying and death. So, but abinda nake so mu sani shine, first of all, the concept of death, is something that used to develop over time. One thing we need to understand, let us define what is dying. Menene dying? Dying means approaching death. When somebody is approaching death, meaning is in a stage of dying. To menene death? What can we say about death? If we are to define what is death, death is what? Death is defined as irreversible cessation of all vital functions. Irreversible cessation of what? All vital functions, especially as indicated by what? As indicated by permanent stoppage of the heart, when the heart stops completely, permanent stoppage of respiration, and we also talk about permanent stoppage of higher brain functions. When the brain stop functioning, to definitely mun shiga wani stage da ake kiransa death, ka mutu kawai. Duk lokacin da aka ce heart ɗinka ya daina aiki, respiration ɗinka ya daina aiki, brain ɗinka ya daina functioning, definitely death occurs. We can also define death, in other words, is the cessation or permanent termination. Permanent what? Permanent termination of all the biological functions that what? That sustain a living organism. All biological functions. What are biological functions? We know that breathing is there, heartbeat is there. You understand? All things that can make you to be alive. And they permanently stop. That is what we refer to as death. Now, the next thing that is very, very important for us to look into is what? Is physiologic sign of death. What are the physiologic sign of death? Idan kana so ka ga sign na mutuwa, wani irin sign ne ake gani don a tabbatar da wannan sign ne na death? There are some four main, characteristics of what? Characteristic changes that used to occur, which are, number one, loss of muscle tone. When you coincident, as you have seen, the muscle tone has disappeared, definitely death occurs. When you have a slowing of circulation. When the circulation is slow in what? In the body system, definitely this one is also a sign of death. Maybe you may feel pulse is not there, or the heartbeat is not visible enough. The heartbeat is very slow and you cannot feel it very well. That one, there is a shortage of or slow in circulation. When that one occurs, definitely ka tabbatar wannan wata alama ce na mutuwa. We also have changes in vital sign. Idan kaga ka taking vital sign, kaga cewa maybe blood pressure yayi low haka, kaman ka ce maybe 70 over 40 over 20, you understand, systolic ya sauka sosai, systolic kansa yana wanda ya kamata a same shi 140, 130, 120, 110, ka tarar da shi ya dawo 70. Ka zo diastolic ya kamata ka same shi 80, 70, 90, ka zo ka same shi 25 or 30 or 40. Definitely this one is a sign of death. What we are trying to say, anything that will alter a patient's vital sign, maybe temperature yayi low to the extent mun ce 36.2 to 37.2 degrees Celsius, ka zo ka tarar da shi yana nan below 30 for an adult is very abnormal. When the temperature is very low, definitely that one is also a sign of patient is going into shock, or the patient is going to another condition that can lead him to death. Another thing, maybe you find that the respiration is what? The patient respiration is very, very low. In the sense that we know that of adult is what? Is 18 to 20 cycle per minute. Sai ka zo ka tarar da shi 10, ka zo ka tarar da shi 8 cycle per minute, ko ka zo ka tarar da shi 12 da wani abu, ka san definitely wannan is another sign that the patient's breathing is what? Is being affected. When the patient's breathing is affected, definitely is a problem. As we define death, we said it's a stoppage of respiration, it's a stoppage of heart, it's a stoppage of brain function, and it's the brain and it's the heart that control the circulation of blood, and we know it's the brain that control the thermoregulation center is in the brain. The thermostat is what is part of the brain that used to control the temperature of the body. And also when the thermoregulation center is affected, definitely the general body will be affected. When the respiration, you know that when the respiration is affected, the general body system will be affected. When there is no oxygen that is being taken in ba mutum bai shakan iska, mutum heart ɗinsa bai pumping blood yanda ya kamata, akwai alamu na mutuwa. Sensory impairment, when somebody cannot sense anything. Ka shiga cikin zafi baka gane kana cikin zafi, ka shiga cikin sanyi baka gane kana cikin sanyi, wani abu ya soke ka baka gane wani abu ya soke ka. In fact baka sensing kanshi ko wari ko wani abu, baka jin wani abu, baka iya ganin wani abu, ko baka shakan wani abu. All these kinds of things, baka iya gane ɗanɗanon wani abu mai daɗi ko mara daɗi ko mai wani abu. All these kinds of sensory part of the body, when they are affected, definitely there is a serious problem. Now, the following guidelines for physician as indications of death. Number 1, the physician may see total lack of response to external stimuli. That one, he can serve as what? As an indications of death. Then there is no muscular movement, especially breathing. You understand? That's the muscles of respiration. You understand? Costal muscles and diaphragm. Maybe there is no movement. You don't see any expansion of the chest. You understand? The abdomen is not expanding. The chest is not expanding. There is no symmetrical movement. You know that definitely there is a problem. Idan har kaga babu wannan, zai definitely zai gane cewa indication in a death. No reflexes. If there is no reflexes at all, when it's indication of what? Of death. No, if there is a flat encephalogram, if the encephalogram shows flat, nothing, no any sign of what? Of respiration, of heartbeat, of everything, that shows definitely there is a indications of death. One is a guidelines for a word for a physician. So the next thing we are going to look at is what? Is dying patient. We may help the dying patient meet his or her physiological needs, spiritual needs, emotional needs. All these, we can help the dying patient to meet all these kinds of things. Mistake din da muke yi shine ba mu taimakawa mara lafiya ko wanda yake kokarin mutuwa ya cimma waɗannan abubuwan, especially physiological need, kamar kuma wasu abubuwan da suka shafi spiritual need, wasu abubuwan emotional need ne. Mu nurses, mu ma'aikatan lafiya ne, mu ne wanda kashin bayan masu kiwon lafiya, wanda za mu taimakawa dying patient ya samu waɗannan abubuwan, ba mu taimaka musu. Now I'm telling us on how to know, how to at least to know how to achieve this thing. I'm teaching you in this class to know how to achieve this what? Physiological need of a dying patient, emotional need of a dying patient, spiritual need of a dying patient. Now let us look at the next thing. Let us look at how to what? Meet those physiological needs of the dying patient. Number 1, provide personal hygiene measures. Can provide the most personal hygiene measures. Number 2, control the pain. You understand? Pain relief is one of our fundamental, responsibility as nurses. Pain relief, you understand? Alleviation of pains. Dole ne ka koyi yanda zaka controlling masa pain. As a word, zai taimaka masa wajen physiological needs nasa ya dan ragu. You understand? Relieving respiratory difficulties. When somebody is having difficulties in his respiration, as a nurse, me da ka mishi, mukan bar mutum a kwance flat, which bai kamata ba. You either put him in a cardiac bed, Fowler's position. Position him in a Fowler's position. Give him one nursing position that is called Fowler's position, whether low Fowler's position, semi-Fowler's position, or high Fowler's position. Or put him in cardiac bed and add more pillows for him to at least have ease in his respiration. We also have to assist with movement. We have to assist the patient or the dying patient in movement, assist him in nutrition, assist him in hydration, assist the patient in elimination. If the patient cannot eliminate, put catheter for him. That one can help him physiologically to have that need, to satisfy that need he has as a dying patient. Relief in hydration. If the patient is dehydrated, encourage the physician to prescribe some infusion for the patient that are appropriate for him to at least have that physiological satisfaction, providing comfort to the patients and relieving pain. You are expected to do whatever you can as a nurse to relieve the patients from pain and provide comfort to him, which is one of the aim of this unit, Foundation of Nursing 4, Unit 3, to provide what? Comfort to a dying patient. How do you do that? This is how you are supposed to do it. How do you provide comfort to a patient? You have to make the bed for him. You have to ensure him on a suitable mattress. You have to ensure the patient has all he needs. If it is ventilation, provide ventilation for him. If he did not, at least if he cannot change his position by himself, put him in a comfortable position. Ask him, let the patient have comfort on his bed, so that this one can help him, can enable him to at least satisfy with what he wants to have on his bed as a physiological need. So let us continue. Mu ci gaba da abun da na gaba. Abu na gaba shine spiritual needs. What are the spiritual needs of a patient, of a dying patient? Number 1, identify the patient's spiritual needs. Ka identify menene spiritual needs na wannan dying patient din. A nan ne za ka gane me za ka mishi. Then the next thing shine respect the beliefs of patients. Wasu patients suna da belief nasu. As a nurse on a dying period, respecting, ka girma, ka darajanta beliefs nashi. You understand? Kada you are having a Christian dying patient with you, ka neglecting beliefs nashi. Kada you have a Muslims dying patient, ka yi neglecting beliefs nashi. Idan yana adda both side ku respecting beliefs nasu, so that as spiritual needs nashi, dan ka satisfy spiritual needs nashi, to dole ne ka respecting beliefs in da yake da shi a daidai lokacin da yake mutuwa, ko me yake bari shi ka girmama abin da yake. You understand? Be willing to listen and discuss issues of spirituality. You as a healthcare provider, you must be willing to listen to whatever and any discussion or issues of spirituality of that particular dying patient. Listen to him. If he's talking, if he's saying something, you have to be willing to listen to what he is going to be saying. Demonstrate empathy. You have to demonstrate a sign of empathy toward the situation he is in. You have to demonstrate some kinds of empathy to that particular period he is experiencing. Wannan kana yi kuma at the same time kana satisfying spiritual needs nationally. Another thing we also have to understand in spiritual need is to discuss or is to look at something like supportive presence. You have to be present throughout. Most of us sai mu bar patient lokacin da yake mutuwa, sai ka je ka zauna a nursing station ko sai ka yi ta wasu harkokinka bayan yana kokarin zai mutu. Abin da ya kamata ka yi shine ka satisfy spiritual need nasa wajen ka providing supportive presence. Let us also discuss the next one, which is emotional support. How do we give patients emotional support? Compassion. Number 1, shine compassion. Compassion is in desire to help the particular person. Idan kana da desireness na ka taimake shi, wallahi emotionally zai zama satisfied. You understand? Responsiveness to emotional need. Some used to give you some sign that they emotionally need something. Then you as a healthcare provider, as a nurse, give him that responsiveness to that emotional need he has demonstrated to you. Expressing empathy. Show some kind of empathy. Be saying some talks that that shows empathy. You understand? At least talk to the patients in a manner. Reassure the patients. You understand? Talk to him in a simple manner. Express some empathy to that particular patient. Wannan in kana yana tabbatar da kana showing empathy wa wannan patient. Attending wishes. There are some wishes that patients will be saying, or there are some things they will be, you have to be attending to those wishes of that particular dying patient. Being, present, you have to be present throughout. You understand? Some of them, they just want your presence. When you are there, they will emotionally be satisfied that someone is close to them, taking care of them, or showing concern to their problem. Wannan duka wani abu ne wanda yake da matukar muhimmanci mu nuna concern namu akai. Now the next thing that we are going to look is physical changes after death. What are the physical changes after death? 1. Pupils fixed. 1. Kagan? And dilated. The pupils will be dilated and they will fix at one place. Algo Mortis. Algo Mortis is rapid cooling of the body. Rapid cooling of the body. The body will be cool rapidly. You understand? That is what Algo Mortis. We have Rigor Mortis. Rigor Mortis, she is stiffness of the body. Develops like 2 to 4 hours after the death. Stiffness of the body, which develops 2 to 4 hours after death. Then we also have Rigor Mortis. That is Rigor Mortis. We have Algo Mortis and Rigor Mortis. Then we have Livor Mortis. Livor Mortis is what? Purple discoloration of skin. Independent areas. There are some purple discoloration of skin in independent areas. So these are some of the things that we also have to observe to serve as a word physiological changes after death. So our next discussion, after talking about the physical changes after death, we are going to continue our discussion by knowing care after death. What are the kinds of care that we give to a dead person after death? As a nurse, wani irin kulawa zaka bai wa mutumin da already ya riga da ya rasu? Definitely wannan shi za mu duba. Number 1, care after death. Death declaration or death certificate by physicians. There are something that we call death declaration and or death certificate or death certification by physicians. One is done by physician. There is positioning the body, straightening, and we also put the arms laid at the side. Zaka kwantar da arms in at the side, zaka straightening body in patient, jikinsa duka ka miƙar, ka sa hannayensa ta gefensa duka ka miƙar da hannayensa ta gefe, ka putin nashi da into position, straight position. You understand? Especially you can put the patient or the dead body in a dorsal position. Ka kwantar da shi ta bayan shi, ka miƙar da hannayensa ta gefe, sannan ka tabbatar ka putin nashi into straight position. Then eyes are closed as in sleep. Ka rufe idanuwansa. Mostly muna manta waɗannan abubuwan domin in ya mutu already idanuwansa suna haka, to sai ka rufe idanuwansa. As a nurse, wannan care ne da ake bayarwa after death. Dentures are removed. Any dentures, you can remove the dentures that irin duk wani artificial teeth wanda aka sa wa mara lafiya in ya mutu kana iya, yana da kyau ka cire su. You have to remove all these dentures and put the chin in position. You understand? Any bandaging, you also have to know how to put that one, how to remove that one. You have to put the chin in position. You understand? That's prop chin in position with bandaging. You can do that to a dead body. All appliances used for what? For patient's care, you have to remove them, especially catheter, IV set, that's intravenous set, that's IV lines kenan, ka cire. In akwai catheter tubing, ka cire. Duka waɗannan, maybe patient has NG tube, you have to remove all those things. Or maybe patient has underwater seal drainage tube, ka cire. All these kind, or yana da tracheal tube, ka cire. All these kinds of things that are used, all these appliances da aka yi amfani da su wajen ba da care na patients, you have to remove them. That one also you can remove them. You understand? Then all orifices are to be plugged with cotton wool. You have to prevent escape of body discharges. Duk wani nurse, baki, kunne duka ana da kyau ka tabbatar cewa ka yi putting cotton wool don ka rufe. If it is anus, vaginal orifice, you have to close them to avoid what discharges da yake fitowa. Don akwai wani ruwa da zai ke fitowa, definitely zai causing problem, ko da an masa wani wanka, an masa wrapping ɗinsa da likafaninsa da wasu abubuwa, musamman ko kuma a bedsheet ko wani ka rufe shi da wani zanni ko wani abu, duka zai ɓaɓɓata su, don in baka rurrufe ba za a samu problem. As a nursing care that we give to a dead body after death, you have to close those orifice after the patient has died. Send body clean and neatly dressed. When you are taking the corpse to the mortuary, you have to make sure you kept the body clean and neat to send the person body to the mortuary well clean and neat. Then also prevention of spread of disease, that is sealing body. You have to also make sure that you ensure that prevention of spread of disease, that is you have to seal the body. That one is very, very important. Then that you also you have to make sure you put identification tag. Can put in identification tag in the situation whereby akwai patients masu similar names, akwai patients masu similar address, akwai patients masu similar age. You understand? All these kinds of things is possible for you to have the patient that has similar names, maybe the same words. An ce Aisha Abubakar, a zuwa ƙara cewa akwai Aisha Abubakar, the same name. Idan har baka put in hospital number ba, definitely hospital number must be unique, but amma names can be the same, address can be coincidentally the same, a lot of things can be the same. So you have to make sure that you put identification tag. If relatives are present, then body is handed over to them. If in case, you understand, with a written word, legal authority permission, idan har relatives suna nan, wannan dead body din ka gwada cewa musu suna iya tafiya da shi gida, suna iya in za su zo su sallace, in suna son su zo su sallace shi a mortuary, ko suna son su zo da akwatin su, if they are Christian za su dauki corpse su a mortuary, za su kai shi state ɗinsa ne, garinsa ne, mahaifansa da sauransu. They are free, ka gaya musu, they have that every right for you to tell them to hand over the body to them with a written, proper written legal authority, permission. Then maintain record for dates, updates. You have to register the dead body into a register. There must be a register for dead person. Dole ka je ka shigar da admission register din shi. Muna da man mostly admission book, admission register book. Kai admitting nashi. Discharge aka masa, date ne, assumption ne, whatever, lama ne, you have to go and indicate. Then there must be a report book. You have to make sure you keep record for the date. Inform an authority for the register of dates for body, that is for the body. You have to, for the dead body, you have to make sure that you inform the authority about whatever you are trying to explain here. You understand, as a care that you give after death. How does documents or record help the patients? The document or the recorded information help the relatives in tracing all the information when the patient died, what caused the death, whatever lead to the death can equally help the relatives to trace. In case that person is a civil servant, they may use it to what? As an evidence or as an indications of their person has died. Maybe if there are some benefit that they have to get from government or from where he is working, either it's a company, they can equally use it. Or in case of any case that may arise that we may not know, that document or that record can help others people out, either the healthcare providers or either anything that happens to the dead body. That one also help is for legal purpose. Sometimes it's also serve as a legal purpose to a particular caregiver, and other people that can require or that can make request of the record or information about the patient. So with that, we have come to the end of today's lectures under this episode. If there is anything, any correction, any idea you have, any suggestion, please, you are free to drop it under this video comment section. We are welcoming all the ideas, all the suggestions, all the corrections. Please, we are ready to correct ourselves. We are ready to do whatever suggestion, ideas, or anything you want us to comply or you want us to make any correction about. We are ready to comply. Thank you so much for your support. Thank you so much for watching the video. Any question, please, you are free to drop it under this comment section. Please, if you are watching this video or if you are coming to our YouTube channel for the first time, help us and subscribe our channel. Or if you have already subscribed, please click the like button to like our video to help us promote our lectures to other people that are always waiting for the lectures. Thank you so much. I remain MrFashkar, the lecturer, on my YouTube channel called MrFashkar Nurses TV. Peace out. Have a nice day.
We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation. Immaculate and amicable, we are the source of hope to ailing ones and the foundation for building a healthy world. Together we shall stand. No seas of grace, no seas of caring, and the epitome of humility in service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse. From near and far we have gathered with one goal, to uphold the good name of our profession, and for neatness and splendor